Hi, I'm Nurse Sandy. I'm going to talk to you today about medical care coordination and advocacy. We're in the age of specialization, and not just medical care specialization, it has even gone down to the micro-specialization area. You may have an orthopedist, but then you have an orthopedist that only works on the shoulder, or the leg, or the back, or the neck. And you have that for every clinical specialty. If you have an ache and pain, do you know who to go to? Of course, we all start with our primary care provider. He is a generalist, or she, or family medicine. Medical care has become so specialized that even generalists aren't sure of where to send you for the best care to give you aid, comfort, and treatment for what ails you. We may have 5 or 6 different doctors on our team for wellness. How do you know if you're getting better? How do you know? Do they talk to each other? Does Dr. A know what Dr. B is doing? Probably not. There is no internal communication among healthcare providers. Why? Well, we're in the age of HIPAA. And the tenuous situation of medical care right now, we don't know what's going to be portable, not portable, considered pre-existing, considered new, considered maybe an aggravation or an exacerbation of a pre-existing condition. Where does it fall? Who is going to navigate the seas of your medical care so that you not only get prompt, effective, accurate care, but make it cost effective so you're not doctor hopping? A medical care coordinator, an advocate, someone who speaks for you, asks the questions you don't know to ask, someone that makes sure everybody is talking. You are not just an arm or a leg or a head. You are a whole person. As a whole person, you need someone that can make sure all the specialists come together to treat you as a whole. A medical care coordinator and advocate can do that for you and or your loved ones. They do an assessment, ask you all the hard questions to get answers and responses that you may forget to fill out on a form when you're just writing quickly 10 minutes before your allotted appointment time. With the decrease in cost allowances for medical care, doctors no longer have the luxury to spend a lot of time with you. You have to make that time count. And a medical care coordinator and advocate can help you do that. Also, if they want to order tests, lab work, if you need some aids to help you maintain your function, improve your function, the medical care coordinator can consider all those services and where you live, how you're going to get there, and how to use it within your environment. Your medical advocate and care coordinator will go to your home and make sure you understand the directions that you were given. The biggest problem in medical care is you think you understand what the doctor is saying before you walk out the door. Yet, when you go home, oh, was I supposed to do this before I ate or after I ate? Sometimes in the world of getting on with our life, we need help. Medical care coordinator can do that. Many of you probably don't know that Dr. Seuss wrote one adult book. I'm going to read a little bit of that. It's called You're Only Old Once. One day, you will read in the National Geographic of a faraway land with no smelly bad traffic. In those green pasteurized mountains of Fatafa City, at 100, everybody feels fine at 103, because the air that they breathe is potassium free. And because they chew nuts from a tut-a-tut tree, it gives their teeth strength and lengthen their hair. And they live without doctors, with nary a care. Yes, we'd all like to go to that land. However, in lieu of that, when you're in doubt and you'll need someone with clout, that is the time for Nurse Sandi to shout. She'll give you good care from the medical crew. Your needs will be met, or they better beware. Nurse Sandi demands the best of the lot, as one life is all you've got.